Patellofemoral pain syndrome. What exactly is a patellofemoral pain syndrome? It's an entity involving the patellofemoral joint as well as the knee joint. It's commonly called as anterior knee pain syndrome, was previously also called as idiopathic chondromalacia patelli. By the name, you can really understand what exactly was initially thought of the pathogenesis or the problem where we thought of is that it's chondromalacia patelli, which means mainly the problem was centered around the cartilage of the patella. But now a new theory has come up of the overuse injury and which may be associated with surgery as well. And all this actually has resulted in a new name which is given to this disease, also called as anterior knee pain or patellofemoral pain syndrome. Pain is mainly localized over or centered over and around the patella. There is actually patient complaints of vague, dull, aching pain, which is usually aggravated by activity, especially in our case study. She was dancing and she was an avid dancer. So whenever she danced a lot, this resulted in this sort of a problem leading to patellofemoral pain syndrome. These usually patients have a problem whenever they actually increase their activity related. For example, they go to a movie theater, they sit there for at least 2 to 3 hours. This usually the pain starts right after that as well. For example, these patients when they sit or squat, this also results in kind of a pain because of the mechanical overload over the cartilage. Usually this patient complains that whenever they climb stairs or come down from the stairs, and whenever this activity is repeated in the office, this has actually resulted in patellofemoral pain syndrome. So it's actually an entity in which the pain is diffuse, dull, aching around the knee as well as the patella, and more commonly towards the anterior as well as the medial aspect of the knee. More commonly towards the females, and usually it's more common in the adolescent age group or in the early 20s. Our case study, she was a 17-year-old female. She was a college student and she was a highly active individual, that she was actually dancing about 18 hours a week. So usually this is more common entity in a females who are active, young, and actually have usually increased athletic activity or activities like outgoing sports or like dancing. Usually this is also common in these females, but it can also be associated with overuse injuries in an older age group. And when the ladies of, let's say, 40s or 50s come to you, they usually complain of having a pain when they were sitting in certain position for a prolonged time, or when they sit or squat, this results in increased pain over the left knee joint, or it could be also the right or left, it could be any joint, but more commonly usually one of the knee is involved. Bilateral disease is quite rare. Now this is important to understand. Whatever the underlying problem is, usually the pain it's such that patient can continue his or her daily living for quite a prolonged time. So usually the history is always about 6 months to 1 year, 8 months, 9 months. The patient is having a problem, but patient has continued to do his or her activities. But once a certain threshold is reached and pain becomes severe enough, usually patient comes and consults the doctor in the OPD. So whenever you have such a patient who is coming with a chronic history of her pain is dull, achy, usually centered around anterior middle aspect of the knee, in and around patella, with no clear history of any injury, with the ligaments all intact on examination, the first thing you should think of is patellofemoral pain syndrome.